N-acetylcysteine is an amino acid derivative of L-cysteine that has many health functions and has been studied for decades. NAC, as it's called in common parlance, is an effective antioxidant. It's a precursor for glutathione, which is your body's master antioxidant. It has antiviral properties, and it's what's called a mucolytic, which means it helps break up mucus. And so we'll touch on its various roles today, but the focus of this video is on the mucolytic capacity of NAC. Now, NAC as a mucolytic is often used for lung issues like infections, COPD, cystic fibrosis, things like that. And so we're going to answer the question that I had recently on a webinar. That was a great question that asked, if NAC is such a good mucolytic agent in the lungs, is it negatively impacting other areas of our body that are lined with mucus, say the gut? Okay, since the gut is lined with mucus, if we're taking NAC to promote mucus breakdown in the lungs for, say, COPD, are we breaking down our gut mucosal barrier too, and maybe opening ourselves up to dysbiosis or leaky gut? That's a great question, and I've got some papers today to help us answer it. So we'll start with this one from 2018 from the Journal of Free Radical Research. And again, it's entitled NAC as an antioxidant and disulfide breaking agent. And the mucolytic activity of NAC is it goes and breaks what are called disulfide bonds in the mucus. And we're going to get there momentarily. So if we look at a picture first, you could look at mucus here on the left where the red S's are. This would be a highly cross-linked mucus. So if you, let me change colors. So if you see these S's here, they are the sulfide bonds, and they're disulfide because it's an S connecting to an S. Not that that really matters to anyone who are other than organic chemistry nerds here, but these are the bonds that when these S's bind, see this is highly cross-linked versus this is not as highly cross-linked. These have, they're not disulfide, they're singular sulfide bonds. When you get disulfide bonds, that makes the mucus thicker and elastic and more viscous, okay? And NAC will break down these disulfide bonds and make the mucus thinner, reduce viscosity so it can flow better. And that's important in the lungs because in the lungs, if we draw a person's lungs here, there's one lung, say, they're like two balloons in our chest. Ooh, that's not too good. But here we go. So you breathe in air and it comes down your trachea and splits and goes off into one of your lungs here. Okay. Well, if we zoom in on the bronchi, we zoom into that, the lung has little hairs on both sides called cilia. And over those cilia is mucus and, say, pollen and maybe the viral infection you have or the bacterial infection you have. And when the mucus is low viscosity and thin and just normal mucus from a healthy lung, these cilia or these hairs, they beat and they perform what's called a mucociliary escalator. So they're basically going to move the mucus and whatever's contained in it up through the lung, out, so you can swallow it down to the GI and get rid of it or spit it out, okay? But if you get highly cross-linked, higher viscous mucus, that mucus cannot be lifted by that mucociliary escalator. So now you get that glob of mucus sitting there in the lung, and that could obstruct the lung. So that could cause obstruction, collapsed lung, COPD, lung inflammation, fibrosis, all kinds of issues. So we need thin, healthy mucus that we can easily move with the mucociliary escalator up and out. And NAC can help us get there. So let's read some of the details. And so what I'm passing over here is the part of the paper that's talking about the NAC antioxidant effect. And I'm actually going to come back and read it because it will be relevant later in the paper. So research shows that NAC has antioxidant activity related to at least 3 different mechanisms. One, it's a direct antioxidant. So, if you have oxidative stress or rust, is the metaphor I use commonly, you can use NAC to directly combat that rust as an antioxidant response. It's also an indirect antioxidant as a result of its ability to be a precursor for glutathione, which is the master antioxidant in our body. So it can directly act as an antioxidant, or it can indirectly act as by raising your glutathione levels and let glutathione do the antioxidant activity. And you may notice here that the cysteine, which NAC is a precursor of, NAC is N-acetylcysteine, so it's delivering cysteine to the body. That need for cysteine is the rate limiting step in glutathione production. So if you don't have enough cysteine around, you're not going to make glutathione. And so you're open up to more oxidative stress and infection and poor liver detox and things like that. And then the third function by which NAC can act as an antioxidant is by breaking the disulfide bonds. And in doing that, not only is it helping the mucus be less viscous, but it's also releasing what are called thiols, which are a class of antioxidants. So by breaking those bonds, it's releasing thiols back to the body to have materials to function in oxidation reduction reactions. So jumping down further here, they talk more about NAC as and its effect on raising glutathione. If you've been in the health space long enough, you may have seen articles that say, NAC won't raise glutathione effectively, or, taking glutathione is useless, blah, blah, blah. Well, that's not right if you look at the science. They list multiple papers here that say taking NAC orally increases glutathione in your red blood cells and in your immune cells. Another paper saw a significant and transient increase of glutathione in white blood cells after an oral dose of 800 milligrams. A different study, 1,200 milligrams of NAC given to healthy people for 8 days significantly increased their blood glutathione by a third. In workers exposed to lead, giving them 400 or 800 milligrams of NAC raised their glutathione levels 5 or 6% respectively. When giving IV NAC, 8 patients with pulmonary fibrosis showed that NAC was found to significantly increase glutathione in their lung fluids. So that's very important. It was also found that oral treatment with NAC, given 600 milligrams 3 times a day for 5 days, in non-smoking patients that had idiopathic pulmonary fibrosis, which basically means, idiopathic means we don't know where it came from. So in patients that weren't smokers that had fibrotic lungs, that was unexplainable, when they gave them 600 milligrams 3 times a day for 5 days of NAC, they had a significantly increased glutathione level in their lung fluids, to the point that they reached normal glutathione levels in the lungs. And that's important because glutathione pushes back against fibrosis. And so these people have fibrotic lungs and have low glutathione. If you don't know what's causing the fibrotic lungs, perhaps not having enough glutathione is one cause for those people. So using NAC to raise their glutathione level to normal may be significantly improve their quality of life and perhaps their disease process. So the authors state, based on these results, we can conclude that in the case of significant oxidative stress or exposure to xenobiotics, so environmental toxins, the pool of glutathione can be depleted, leaving the oxidants and toxins free to react with the body. In red here. But NAC given in acute or chronic dosing was found to significantly replenish glutathione pools in areas such as the liver, skin, lung, and brain, thus preventing the damaging effects in these areas. So again, NAC is safe and cheap and very effective. And so, if you're looking for an antioxidant that's effective, NAC has been proven by many studies to be. If you're looking for an antiviral as well and a mucolytic as well, all in one package, NAC is your guy. So let's look now at its mucus breaking skills, which is the main reason why we're making this video. So here, the reducing ability of NAC toward the disulfide crosslinks is clearly responsible for its mucolytic activity. In a healthy lung, so I want to get this picture in the screen here. In the healthy lung, which is over here, this would be the healthy lung. Okay. In a healthy lung, the low elastic modulus of healthy airway mucus indicates a low density of mucin crosslinks. So basically, there's not a lot of cross-linking here that you can see, right? Unlike this picture. So in a healthy lung, there's low levels of cross-links, and so lightly cross-linked mucus are easily transported by that mucociliary escalator. Okay, those hairs can easily move the mucus up out of your lung so you can swallow it or spit it out. In red, in lung disease characterized by inflammatory conditions, the oxidative burst causes oxidation of, so here's a lot of nerdy science, so let me read it and I'll translate it for you. But in lung disease characterized by inflammatory conditions, the oxidative burst causes oxidation of internal cysteine thiols, which on one hand may contribute to antioxidant effect of mucus, but on the other hand could modify the physical properties of mucus by generating more disulfide cross-linkages. Okay. The resulting heavily cross-linked mucus is not easily transported out of the lung by the cilia, by the hairs, okay, and accumulates to cause airflow obstruction, atelectasis, and lung infection. Pathologic mucus is typically highly elastic and thought to occur as a downstream consequence of airway inflammation. NAC is a mucolytic agent able to reduce the heavy cross-linked mucus. Okay, so we mentioned this before, but this is important to discern. So in a healthy lung, you're going to have mucus. In an unhealthy lung, you're going to have mucus. But in a healthy lung, the mucus is not highly cross-linked, and through just normal physiologic processes, you can clear that mucus, right? You can give it a good and spit it out as necessary. And you often don't even need to clear your throat because the mucociliary escalator is doing its job. But in an unhealthy lung, where there's inflammation present, that's going to drive more cross linkages, which makes it a heavily viscous mucus that's hard to move by that mucociliary escalator. So that mucus accumulates, and now we can have lots of different lung issues. So what do we do? NAC, that's what this video is about, right? So NAC in two ways can help you. NAC can block the oxidative stress, which leads to and promotes thicker mucus, and it also can break these bonds, shifting you back to healthy mucus, which is easier to pick out naturally. So NAC helps break down those disulfide bonds and prevent them from happening via its antioxidant capacity. Pretty cool. The mucolytic effect of NAC given by aerosol or by bronchotracheal administration is clearly due to the direct reducing ability of NAC, which is directly transported into the mucus. So what this is saying is NAC given by aerosol. So there's your nebulizer. Okay. Or bronchotracheal administration, you're probably not going to do that unless you're in the hospital. Okay, but you can all get a nebulizer. And so NAC given by a nebulizer via aerosol will break down the mucus. And that's what's got the most research behind it to effectively break the mucus. Then down here in this paragraph, they say that the mucolytic effect of NAC orally is more debatable. Basically, they're saying here that they need more research, and they're talking through how it can be effective still. So NAC after oral treatment, breaking down the mucus, is debatable because several studies have shown a limited effect. This could be explained by the reduced bioavailability of NAC in the lung fluid when given orally, right? Because you swallow the capsule, goes to the gut, has to be broken down, reconstituted, and make its way to the lung. Whereas if you just use the nebulizer, you're inhaling it straight into the lungs. The reducing ability of NAC is given by the molecule itself in acetylated form and not by deacetylated cysteine or glutathione. So this is saying the mucus busting qualities of NAC is the NAC. It's not when it turns into cysteine or glutathione. So the NAC is what's doing it. However, an increase of cysteine and or glutathione induced by the NAC in the lung fluid can have other effects such as an antioxidant, which can prevent the formation of heavy cross-linked mucus, which we showed up here, right? So you could also draw here, you could say cysteine, and you could say glutathione. And so what they're saying is if it's not NAC directly going and breaking orally, breaking up the disulfide bonds, its conversion into one of these two is helping clear mucus by blocking the oxidative stress so we don't get more thick mucus. Hope that makes sense, drawing wise. However, a better understanding of the distribution of NAC in the lung fluids requires more study, basically. Okay, so best would be nebulizer, apparently, from this study, but you're also getting an effect from oral treatment. It's just harder to tell how much of an effect we're getting compared to the nebulizer. So it's still worthwhile to take oral NAC, and just from a clinical experience, anecdotal perspective, I've seen multiple patients be helped with mucus busting through oral NAC use. So while we wait for them to do more research, we'll still glean the benefits of empirical treatment here. So this study I wanted to show you is looking at the lungs, okay? Because this was the understanding that I had when the question was asked. I solidly knew NAC is effective for breaking up lung mucus, and here's all the minutia you could want on that, okay? But then the second part of the question was, okay, it's effective in breaking up lung mucus, but what about gut? Is it hurting us to be using NAC for this reason, but the NAC impacting our gut mucus too? Well, let's go back in time 11 years backwards from this study, 2007, in the American Journal of Physiological Gastroenterology, Liver Physiology. Basically, this paper was looking at mice that with cystic fibrosis, okay? And specifically mice with cystic fibrosis in the small intestine. So cystic fibrosis drives an accumulation of mucus that will clog the intestine or the lungs or wherever the disease is manifesting. And so they're studying a mouse model of cystic fibrosis in the small intestine, and they want to see what's better, for breaking up mucus and clearing bacteria and improving the migrating motor complex, laxative and or NAC. So let's go through this. The accumulation of mucus in affected organs is characteristic of cystic fibrosis. In the cystic fibrosis mouse small intestine, there's dramatic mucus accumulation and slowing of the migrating motor complex or peristalsis. So essentially, they're more constipated. You're not getting that clearing wave of peristalsis or motion through the GI tract to push things down the tract. These factors are proposed to play cooperative roles that foster small intestinal bacterial overgrowth, or SIBO, and contribute to immune inflammation in the cystic fibrosis intestine. We hypothesize that decreasing the mucus accumulation would reduce SIBO and might improve other aspects of cystic fibrosis intestinal phenotypes. So we used mice with cystic fibrosis, and we treated them with a laxative or NAC to observe, and importantly, it was oral NAC, to observe what did better in breaking up the mucus. So in red here, treatment with laxative or NAC reduced mucus accumulation by 43% and 50% respectively. So what that means is they both reduce mucus NAC did it slightly better. Laxative and NAC also reduced bacterial overgrowth in the cystic fibrosis intestine by 92% and 63% respectively. So, and if the goal is bacterial overgrowth reduction or clearing bugs, the laxative was better than NAC. And that makes sense, right? Because the laxative is actually causing you to expel things out of the colon, whereas NAC isn't driving that. NAC will kill things, but if you don't also get them out, you're not going to be as effective at clearing them. So in summary, the laxative and NAC treatments of cystic fibrosis mice reduced mucus accumulation similarly, but the laxative was more effective than NAC at reducing bacterial load. Okay, great. But there's more to be learned here to answer our question, is using NAC for mucus clearance in the gut disadvantageous? So this is just saying that mice with cystic fibrosis in the intestine have many of the problems that humans with cystic fibrosis in the intestine experience. So this is, a good model to test these things on. Those symptoms that mice and humans both experience are accumulation of mucus, intestinal obstruction, slowed small intestine transit, okay, which can lead to constipation, small intestinal bacterial overgrowth, inflammation, and failure to thrive. Of these changes, bacterial overgrowth is of interest because it can be responsible for the majority of the other aspects of the intestinal phenotype. In red, secreted gel-forming mucus in the intestine binds bacteria and helps carry them aborally, which means towards the bottom, away from the mouth and out the chute, for efficient clearance from the small intestine. Okay, so what's the role physiologically for mucus? It's saying it right here. Our body produces mucus, and one of its jobs is to bind bacteria in our intestine and carry them out of the small intestine into the colon. Why does that matter? Well, because if we draw a human here, say, and we swallow something, goes into the esophagus, stomach, then small intestine, then large intestine, and out. Okay, let's do this. Stomach, esophagus. Okay, so right here you have the ileocecal valve between the small intestine and the large intestine. And most of your probiotics should reside in the colon or in the large intestine. There are some in the small intestine naturally, but it should be a much, much, much lower number than the large intestine. Well, this ileocecal valve here should be a one-way valve where it only goes this way. Okay. Well, if you get bacterial overgrowth for whatever reason, one reason would be if you lose peristalsis or you lose the downflowing wave to move things down, then proteins and different macronutrients can sit in here, and the bacteria in there can ferment them and reproduce and expand their number, and you get small intestinal bacterial overgrowth. Well, that can drive further gas, bloating, diarrhea, constipation, depending on the gases they're producing. And so the mucus is helping grab those bacteria, and if we also have the peristaltic wave or the migrating motor complex, which we need, we can take them this way and on and out the chute eventually. So the mucus is helping do that. When mucus clearance is impaired, like I just said, bacteria can proliferate in the mucus and may use it as an energy source. So even if you're producing enough mucus, but you're not moving things down and out, now the bacteria can consume the mucus and use it as energy to reproduce, and now you're having SIBO. Mucus accumulation in cystic fibrosis intestine is part due to dehydration, part due to acidity, as well as altered mucus production, which may increase viscosity of the mucus. All right, well, where have we heard high viscosity mucus before? We just heard it in this paper, right? The bad mucus is the high viscosity mucus, right? Good mucus is low viscosity, bad is high. So if we jump back to this paper, it says here, mucus accumulation occurs in these people because of dehydration, acidity, altered mucus production, all of which may increase viscosity of the mucus. So if those things are present, now you no longer have the nice, healthy physiologic mucus. Now you're producing the pathologic mucus. More viscous, may block that intestine. Okay, so it needs to be broken down, maybe fed on by bacteria and drive SIBO. So we would want to break that up. This paragraph saying that it appears that the bacteria actually promote more mucus secretion by the intestine. So when the bacteria colonize, they're actually helping themselves survive by promoting more mucus production, which works against us as the human host. Part of the cystic fibrosis phenotype is a decrease in the migrating motor complex. So you have decreased peristalsis or moving things out. So that allows things to hang around and mucus and bacteria to build up. And this dysmotility or lack of that downgoing wave is a major cause of SIBO. And they showed in a different study that the cystic fibrosis small intestine has a dramatically slower transit time than normal. So again, promoting constipation and SIBO issues. Thus, a combination of viscous dehydrated mucus and slower peristalsis likely combine to allow SIBO in the cystic fibrosis intestine. We propose that abnormal mucus accumulation in the intestine provides a niche for bacterial overgrowth and hypothesize that interventions to improve mucus clearance would be beneficial. So this is talking about them using the laxative. And this paragraph says, the second treatment we used in this study was oral NAC by adding it to the liquid diet of the mice. NAC is a mucolytic that acts as a reducing agent to break disulfide bonds and mucus molecules and thereby decrease viscosity of mucus. That's what this picture was showing us in the lung study. The results of this study show that both the laxative and NAC can reduce mucus accumulation and bacterial load. Okay, so I know there's a lot of talking, but I want to put the piece together for you that to answer that question from last week, the NAC is effective at thinning the mucus wherever you need it, between the lung and the gut at least, because that's what we've looked at with these two studies. And it's probably the same if you're talking about mucus in the sinuses as well. Okay, so there is physiologic mucus or healthy mucus, and there's pathologic mucus, unhealthy mucus. So taking NAC is going to thin the pathologic mucus, whether it's in the lungs or the gut, by breaking these disulfide bonds and allowing physiologic processes, either the mucociliary escalator in the lungs or the migrating motor complex in the gut, to move the mucus out in the proper direction. And that will allow you to have a healthier lung environment or a healthier gut environment. So no worries in terms of taking the NAC and creating issues. If your mucus is already thin and doesn't have a bunch of disulfide bonds, the NAC isn't going to mess with that healthy mucus. And then just to wrap it up here, we started by saying another function of NAC is as an antiviral. And here's a paper from 2022 in the Journal of Infection and Public Health looking at NAC for prevention and treatment of COVID. And they found that NAC is a useful adjunctive strategy for COVID. And here's a mechanism for where it can function in many ways. It functions in many ways to reduce severity of that infection. And they give dosing here, which is useful, because people are always asking what dose. This isn't a recommendation for you. This is straight from the science. Talk to your provider before adding it. But these authors say for infection prophylaxis, so basically for prevention, outpatient treatment and just mild infection, 600 milligrams twice a day by mouth as an antiviral strategy. And then in inpatient treatment, so even if you went in with mild or moderate disease, they said, okay, up the dose to 600 milligrams 3 times a day by mouth. And then if you're real severe, then they use IV. So an effective strategy, antiviral strategy, is shown here by multiple papers. And this paragraph says, NAC as a treatment has shown positive impact for health outcomes in patients with respiratory conditions such as community-acquired pneumonia, COPD, acute respiratory distress syndrome, and more recently, COVID-19. And in red here, the information currently available supports the use of NAC in symptomatic patients with COVID at a minimum dose of 1,200 milligrams per day, okay, which is 600 twice a day by mouth. In patients with severe disease and respiratory compromise, the use of IV NAC at a dose of 100 milligrams per kilogram of body weight for at least 3 days may be indicated. And if they have a cytokine storm, they could up that dose even after 24 hours. So this is a study in a big journal of Infection and Public Health, saying, hey, NAC has been shown effective against viruses and against the most recent relevant virus that we all know about. So, and then, one other thing I'll highlight for you that they say right in the abstract, NAC is safe, tolerable, affordable, and easily available. So again, these are things everyone was looking for: natural, safe, easy to get. It's right there. So NAC is something you should have in your functional medicine first aid kit. If you don't have it, doesn't necessarily have to be an everyday thing, but when you want it, it's easier to reach for it in your cupboard when it's already there than have to run out to the store and find some.